the law. The Attorney General's office has a leadership role and position in ensuring that our healthcare providers, our volunteers, and our patients are protected. For the Attorney General, Eric Schneiderman has been a true friend, a champion, and a colleague that I would tell you the reproductive justice movement, the reproductive healthcare providers could not do without. Many are asking, why is it that the Attorney General makes a difference in New York State to be pro-choice? And let me tell you, there is a significant difference between having somebody who's pro-choice and somebody who's just going to protect us in enforcing the law. The Attorney General's office has a leadership role and position in ensuring that our healthcare providers, our volunteers, and our patients are protected. That the contracts that our healthcare centers have with the state of New York are not slowed down in any way, and to ensure that the leadership continues to make access to reproductive health care, including abortion, in New York State will remain the policy and the vision that our New Yorkers believe in. Eric Schneiderman has had a lifelong legacy in ensuring that women have access to reproductive health care. As an escort, as a very young man, and right through his most recent work in the New York State Senate, Eric has been a true champion in pushing through legislation that protects our healthcare workers, volunteers, and patients, that ensures we have access to emergency contraception, that women have the ability to access the full range of reproductive health care regardless of their socioeconomic status. And without a true leader like Eric Schneiderman, the men and women in the state of New York would never have the access to health care that we have today. And we look forward to his leadership in the Attorney General's office as we walk through these last 4 weeks of this election cycle. I'd like to, at this point, introduce Pat McGoon, a member of PPANY of New York State, our Upper Hudson Planned Parenthood chapter, to make a few comments.
I am a board member of Planned Parenthood Advocates of New York State. I'm also a veteran of running Planned Parenthood here in Albany with clinics in Troy and Hudson, and I've been doing that for 16 years. So that means I have done that with the benefit of some fabulous pro-choice attorney generals, and I have also done that with an anti-choice attorney general. I have been in New York State during the Operation Rescue blockades in Buffalo. I have been a Planned Parenthood CEO when I watched the harassment and the active pursuit of some of my colleagues by members of the Attorney General's office. And I have been a CEO when former AG and former Governor Spitzer formed a reproductive rights task force, and then later the current AG had reproductive rights as a prominent part of the civil rights unit. And I know what it's like to be reached out to and to be treated with respect and with understanding of the importance of women's access to the full range of reproductive health services, of the importance of their constitutional right to choice. I also know what it's like to be treated with respect and care with regard to our patients' safety, and to be treated with understanding of how harassment of providers of reproductive choice affect the safety of both the patients and staff who go forward. And finally, as Tracy mentioned, I am a state contractor. I have a large family planning grant from the State Health Department. We have another significant grant for teenage pregnancy prevention. We often have many other smaller grants from a variety of state agencies. And the timeliness of payment under state grants is a critical aspect of our being able to provide services to poor women, to young women, to people in need. In this economic time, we're seeing our numbers go up and up because people are losing their health insurance, they're losing their jobs, they need access to low-cost care. And when we have contracts that are held up someplace in the bureaucracy, we can't get paid. There is not a contract that you have with state government that does not require the signature of the Attorney General's office. And a pro-choice Attorney General can see to it that we have a contract and that we get paid on time. I am thrilled to be here today to participate in our endorsement of Eric Schneiderman. If I had not been asked to participate, I would have asked. I'm delighted to be here.
without further ado, to introduce our endorsed candidate for Attorney General, Eric Schneiderman.
Thank you. Listen, it is an honor to be here. It is a true honor to receive this endorsement. And as noted, since I was 17 years old, I've been involved in the effort to protect a woman's right to choose. After high school, I worked in a clinic for a while in Washington, D.C. when abortion was legal there and illegal in the rest of the southeastern United States. And I've never forgotten the women who came through those doors. Some of them had snuck out on their jobs, they were hiding from their families, some with medical problems, and we can never go back to that, and that has been a core commitment of mine throughout my whole career in public service. The Office of Attorney General can play and must play a critical role in protecting freedom of choice, and my opponent, who has refused to debate me on issues of financial fraud or Wall Street, also is attempting to avoid this issue by saying the Attorney General has nothing to do with freedom of choice. I remember Bob Abrams bringing these historic cases to protect clinics in Buffalo, in Westchester, developing the concept of a zone of privacy to protect clinics when Operation Rescue and other groups were harassing patients, harassing doctors and clinic workers. This is something that only the New York State Attorney General can do. And I promise you, if there's harassment at clinics, you're not going to have someone who takes a passive approach and waits to see if the problem just goes away with me. I will aggressively defend a woman's right to choose and your rights to operate legal reproductive health facilities as aggressively as is necessary. The Attorney General also has to sign off on hospital mergers, and the Attorneys General have actually blocked mergers of hospitals on the basis that they would reduce access to reproductive health services. This office has multiple functions, approving and expediting state contracts, as was mentioned. The Attorney General of New York State has a role to play in the national struggle for freedom of choice. The Attorney General of New York State must provide leadership in this struggle for freedom of choice. I commit to you, I will do that as Attorney General. It's clear that my opponent does not share these views, and it's something that really has to be a little bit chilling, has refused to even state whether or not he thinks his running mate, Carl Palladino's position of no right to freedom of choice, even in cases of rape or incest, is an extreme position. So, look, there's a clear contrast here. The Cuomo-Schneiderman ticket is a pro-choice, forward-thinking ticket that believes in equal justice under law for everyone. Everyone understands that the right to freedom of choice, the right of women to control their own bodies, is a central aspect of equal justice under law. I will fight for that and work for that as Attorney General. I look forward to working with all of you and to moving our state forward in so many positive directions. We certainly are not going to ever go back on the issue of freedom of choice. Thank you very much.